Hey, my name is Kellen Dedge. I'm a student physical therapist assistant from Jeff State, and today we'll be doing a treatment session for a patient who has a compression fracture in their T8 vertebra. Typically, compression fractures occur when there is a load placed upon the spine, and the load is so much that vertebra will collapse. In this case, this patient was twisting and reaching for something and felt pain in their thoracic area and went to the doctor 2 weeks ago and was diagnosed with a compression fracture of the T8 vertebra. The subjective findings for this patient are that they have pain and symptoms are increased with sitting, standing, twisting motions, and with bending forward. Also, they state that they have an inability to make the bed because of the bending over, leaning over, and having to do it. Objectively, they have a kyphotic posture. Their scapula are protracted, which is contributing to rounded shoulders, and their Berg balance scale states a 47 out of a 56, states a 44 out of a 56, which indicates a high risk for falling. So our first technique that we'll be doing is soft tissue mobilization around the T8 paraspinals, really from T6 to T12 paraspinals. And the reason that we will do soft tissue mobilization is that it will help reduce muscle spasms. So we'll go and we'll do that now. So in order to locate T8, what you'll do is you'll find the inferior angle of the scapula parallel to the inferior angle of the scapula. If you come across, you can find T7. This patient experiences a lot of pain when you palpate the spinous process of T8, so we'll be very gentle with that. But just to find it, this is T7, and if you want to go down to T12, it is parallel to the 12th rib. Find the 12th rib, come across, and you have T12. So we'll be doing soft tissue mobilization to the paraspinals of T6 all the way to T12 right here. First thing that we'll do is we'll warm up the tissue. This will permit the patient to relax. And you have to be very careful not to palpate T8 because, again, T8 is very, very tender. So as we're coming past T8, we'll probably let up a little bit on the pressure, but if the patient can tolerate, then we'll continue with longitudinal pressure. Along the paraspinals. So again, this is just warming the tissue up, trying to allow the patient to relax so that the tissue can then relax, and that we can decrease the spasms. As we'll go from T7 all the way to T12 with longitudinal pressure. And the spasms are definitely palpable, and the goal here is just to work out those spasms. And to the other side. Typically, you'd want to do this for a little bit longer so that you could actually tell that those spasms are loosening up. But for the sake of time, we'll move on to the next technique. So again, this patient is in a kyphotic posture. You can see The rounded shoulders, they have rounded shoulders, they're in a kyphotic posture, which places the thoracic spine on flexion. And remember that this patient has pain when they're bending over or when they're in a flex position. So what we want to do is we want to try to decrease those symptoms by helping them, teaching them patient education in terms of postural, good posture and postural alignment. So what we want to do is we want to take these shoulders and think about taking this scapula and pinching your shoulder blades together. So you're going to come up, you're going to bring those together just like that. Very good. Now you also, in order to keep good trunk stability, you want to focus on drawing that belly button in towards your spine, and that's going to activate the transverse abdominis. When you activate the transverse abdominis, that's going to allow this patient to stabilize better so that they can also have a better ability to keep their scapula in a retracted position. You're also going to take your head and you're just going to bring it just like this, just like that. And that's going to keep you from going into a forward head posture. So you're going to take that and I want you to try to hold that position right there. So this is the position that we want to be working on. When you're doing all your activities, when you're even trying to make the bed, when you're reaching for stuff, when you're doing exercises, this is the type of posture that you want to have when we're doing all this stuff. So always thinking about maintaining this posture when we're doing everything. Okay, so we're going to now teach this patient a home exercise that they can do. What we're going to do, this would be after the reevaluation. Their Berg balance score was too low to do this technique, but after their reevaluation, their balance has gotten better. So what we're going to do is we're going to place the patient in a single leg stance. So let's have you get up into a single leg stance just like this. And what you're going to do is you're going to reach forward here, and you're going to touch the wall. You're going to go high. Good. You're going to come out here, all while in a single leg stance. You're going to come down here. And this is going to challenge their balance and it's going to increase their proprioception. And here. Good. Now with your right hand, I want you to go and hit 4 points just like that. Stay on the single leg. Very good. Excellent. Now let's go and get on the right leg, balance on the right leg and lift the left leg up. Now with your right arm, I want you to reach forward. Good. And then coming out here, touching here. Placing a little bit of challenge. What you want to do is you want to get far enough away so you're placing a little bit of challenge so it challenges your balance. Then you're going to reach down here. Then you're going to reach across here. Staying in that stance with your left arm, I want you to hit those 4 points. High, out here, the left, down, and into the right. Now because you're in a single leg stance, good, you can relax. Because you're in a single leg stance, you want to probably keep a table nearby so that if you do lose your balance, you can grab onto that table. So that's a precaution for you while you're doing this. As far as reps, we're going to do this technique. We're going to go here, 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 and here on a single leg. And then we're going to do the left arm here, 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 and here. And then go to the right, here, 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 and to the left. We're going to do that for 3 sets, okay? So we're going to do that. That's 1 set right there. Then we're going to do that for 2 more sets, and we're going to do that 2 times a day. I'm going to give you a piece of paper that you can take home with you, but that's what we're going to be doing as far as home exercise, okay?
Okay.
Given that this patient has no history of back pain and that the compression was to a single vertebra, chances are they should be able to return to a previous level of function. However, due to their osteoporosis, it may be longer than the typical 8 to 12 weeks, perhaps 12 to 15 weeks, until they can return to a previous level of function. Also, some modifications that we will have to teach the patient are that they will have to use proper body mechanics when they're doing activities of daily living, so that will cut down on how much they're flexing at the spine, especially at the cervical spine, at the thoracic spine. So those are the modifications that we'll have to teach them. But other than that, they should be able to return to a previous level of function. Thanks.